So I did after medical school, you can apply for internship. So I did an internship in a rural hospital in Rockhampton. The process to get internship is always stressful. Doesn't matter where you go, it's always going to be stressful because there always seems like there's not enough spots for the international students. But at as far as my year, and I think even the year after me, everyone that wanted a spot got a spot. Some people wait and they might get a spot a week or two before internship starts. But at least in my year, everyone got a spot that wanted a spot. So internship is really good. I applied for a public spot, which was Rockhampton. So apply early, get to know where you want to go in terms of a like a spot that's funded by the government. There are some private spots that are also available. Those are usually in the city, but you are sent quite rural for a couple of months of your training, and you'll learn more about that when you're there. I got accepted to Rockhampton. It was a call at 7 p.m. on a Friday with no caller ID, so luckily I picked up. So internship, again, Rockhampton Hospital, so it's a very small rural center. It was amazing to work in that center because it was small. You got to know a lot of people in that hospital. So like every corner you ran into either an intern or a junior doctor, or you ran into staff that kind of knew your name compared to a big hospital in the city. Rockhampton is good because you can do a rotation in family medicine in a even smaller town, but that was a very good experience, especially if you want to do family medicine, get some reference letters for Australia and Canada. And then after internship, I went back to Brisbane to be a junior house officer. So, like basically, second year out from medical school, you're given a little bit more responsibility. You get to do night shifts. You get to do other rotations and other specialties. You get more money. During that year, I did lots of ophthalmology in pediatrics. Then COVID happened, so that kind of I had a obs gyn rotation lined up, but that got canceled because of that. But I was promoted to the role of a senior house officer during my second year. So yeah, like work in Australia is really good compared to Canada. So I was making more money in Australia as an intern than I am making here as a second year resident. And that's working more hours here. That's doing nights, 24-hour calls here compared to Australia. So Australia, your contract is 37 and a half hours per week of work. And you're paid overtime. So if you go above that, you claim it and it gets paid. So for that reason, work in Australia is much less stressful than here. Okay, again, I think you do have a specific talk on matching back to Canada. I would say out of the 80 that went to Australia, like the first year, everyone wants to come back to Australia. By the end of it, no one wants to come back to us. No one wants to come back to Canada. Sorry. So first year, everyone will raise their hand saying, "I want to go back." Fourth year, maybe 5 people will want to come back, just because lots of reasons to stay in Australia. You make connections. So if you want to do specialties, for example, dermatology, radiology, some of those like subspecialties, it's very hard to do those in Canada, or almost impossible to do them in Canada if you want to come back here. So if you want to do those, you end up staying in Australia. You'll meet boyfriends, you'll meet girlfriends, so you don't want to come back. The lifestyle there is very good, as I said. So working as an intern, as a junior house officer, you only work about 40 hours per week. You get paid overtime, which is not the situation here. So lots of people will stay for that reason. And then other reason is the exams are scary. You write 2 exams before you want to come back to Canada, the NAC OSCE and a multiple choice exam called the MCCQE1. So those exams are stressful. So a lot of people, or some people, will avoid coming back just for that. I have one friend that's actually doing residency in Australia right now for family medicine. So his plan, he has the option of coming back after that training because that's recognized. So people from Canada can go work in Australia as family doctors, and people in Australia can come work as family doctors in Canada, but you have to write one of the exams. So in my year, so I had 80 people go with me to Australia, and I only know of 7 that actually came back. So it's not a very not a option that most people choose at that point, just because they like staying in Australia. Whenever I have people like my friends or family that ask me about their children, should they stay in Canada and do medical school or Australia? I think there's pros and cons of both, but I always say that if they do go to Australia, there's a very good chance that they're not coming back, just because life there is pretty good. And residency so far at the U of S in family medicine has been it's a great program. I highly recommend Saskatoon for their family medicine program. We have a very nice clinical director. We have amazing admin staff. Advice: if you do want to come back to Canada, do speak to someone that is either in the process of coming back or has come back, because you need that advice on when to do exams, where to do your electives, what you should do for your application, because it's a different application compared to Australia. It's much more submit your papers and see if you get an interview or not, whereas Australia's, who writes your interview letters, who do you know that will get you jobs?